different type of arrhythmia. If you have like extra beat from the upper or lower chamber of the heart, we call PAC or premature atrial contraction, or PVC or premature ventricular contraction, that you can see in normal person. People might feel it, people might not feel it. I might have it, you might have it, but we might not feel it. Some people, they very sensitive to it. They feel like, oh, they can't breathe, they can't function normally in their daily living life. Then that's require treatment too. But most of the time, extra beat is something that we normally don't do anything except you very symptomatic. Some type of arrhythmia, such as regular heartbeat but beating slow, you see in people who have who is athlete, you don't do anything. Some people have fast heartbeat but it's normal heartbeat, such as normal heartbeat is 100. If you have heartbeat at 110 or 120, sometimes people feel it. But most of the time, the reason that the heart beating fast have to be some reason. You might have fever, you might have infection, you might have something that abnormal, like hyperthyroidism, which means thyroid function too much, then the heart can beat fast too. All type of arrhythmia is not dangerous. Some of arrhythmia more dangerous could be the one that you have slow heartbeat. If your heart just beating and then it just stop beating for more than 3 seconds, more than 5 seconds, you will faint. Some people fall down, break their legs. Some people driving, and you have some pause like that, then you can cause the accident to yourself and to people on the street too. So that's quite important sometimes. Some people have irregular heartbeats from the upper chamber of the heart. We call atrial fibrillation, which is degenerative disease. That's quite important arrhythmia too, because it can form the blood clot inside of the heart and can go to the brain and cause a stroke. If you have irregular heartbeat from the lower chamber of the heart, that's important too. If your heart normal, then if your heart pumping function, lower chamber of the heart pumping is normal, you might feel just lightheadedness, dizziness. But some people, they have weak heart. Their heart pumping function is poor. When you have that irregular heartbeat from the lower chamber of the heart, you don't have any reserve. So you might faint it, or your heart can just stop beating. So all that's important arrhythmia. So it depends on what type of arrhythmia. It can be just benign, you don't have to do anything. It can be something that you have to really pay attention to it, and it can cause, it can cause you to have sudden cardiac arrest or sudden cardiac death too.